we're going to move on, and we're actually going to discuss this whole Matthew Stafford false positive test result situation that happened last week. I'm assuming everyone has heard by now that Stafford was testing positive, only to find out 3 days later that was actually a false positive. And the team has released a statement regarding the situation. Jimmy, do you want to elaborate on just the statement from the team?
Yeah, so let's talk about what happened. Stafford had at least a couple negative tests before the positive test, then a bunch of negative tests after the positive test. So it was an isolated positive test.
Mm-hmm.
Kelly Stafford stated that on her Instagram, after the second negative, they were told the positive test was a false positive. The team's statement, quote, states that Matthew does not have COVID and never has had COVID. The test was false positive. Here are my thoughts on that. That statement is medically illogical and just wrong. There's no way that the team or the doctors could have known for sure that it was a false positive. The reason is there's no gold standard test to compare it to at this time. And there's also no way to say for sure that Matthew does not and never had COVID. So I don't like that statement. It was simply incorrect and inappropriate to release that kind of a statement. The only way to say a test result is actually wrong is if it was labeled with the wrong name, handled improperly, or contaminated. If this was the case, the test should have been deemed invalid and stricken from the record. So the fact that they were sticking with the positive results suggests the test was done properly.
How do you basically interpret the test results? Like I said, how, especially since the NFL has came out and stated that they're going to be changing the way NFL teams do the whole testing. So how are you going to interpret the way they give those results out now?
Yeah, good question. So the simplest explanation is that Stafford had a false negative surrounding the true positive, not the other way around. False negatives are considered to be far more likely than false positives. The false positive rate is thought to be very low, like 1% or less. The false negative rate, on the other hand, is thought to be pretty high, up to 30 or even 50%. So it's actually much more likely Stafford had a true positive that was surrounded by false negatives rather than a false positive. Here's other explanations, assuming that all the tests were true. One is he could have breathed in some virus into his nose that morning. Maybe somebody coughed in his face. The swab picks up the virus, creates a positive test. Later on, Stafford blows his nose a few times, expunges all the virus. Second possibility, something called sample variance. You could do 10 tests, one right after the other. Some might be negative, some might be positive. This does not mean any of the tests were wrong. Some swabs might have simply collected enough virus matter to be positive, other swabs maybe not. In addition, sample collecting is not an exact science. Collecting a sample requires compliance of the patient as well as skill from the collector. So if the patient is wiggling around, non-compliant, or the tester is not inserting the swab correctly, that false negative rate will increase. Third possibility is Stafford's immune system could have cleared the virus from his system quickly. He may already have immunity from having contracted it sometime in the past few months.
Yeah.
Now, keep in mind that COVID has been around for 6 months or more already. So a significant percentage of the population may have already contracted it. So Stafford may already have antibodies, which helped his body clear the virus from his system very quickly. Even if he wasn't immune, even if he had never been exposed to the virus in the past, his body still could have fought it off quickly, especially if the viral load was low.
Yeah, it's really interesting how they do those tests because, like you said, there could be so much interference between whether just the patient is cooperating and whether the doctor is actually knowing what they're doing. Like Dr. Sills actually did a conference call to sort of clear things up. What were your thoughts on his conference call?
Yeah, so he had a conference call 2 days ago on Friday. He basically shot down everything in the lying statement. He acknowledged that the test was likely a true positive, and he did not use the term false positive at all in the statement. He used the terminology unconfirmed positive instead. That's much more medically acceptable and appropriate. He also confirmed that it was possible and even quite likely that Stafford has had COVID at some point. And I agree that it is likely that Stafford has been infected at some point.
Yeah.
Given that Stafford and family are healthy, this is actually good news for Lions fans because it means Stafford might have some immunity going into the season, which will
Mhm.
hopefully decrease the likelihood of positive tests.
Yeah, exactly. Again, talked about that probably 100 times on the show already. That it's better to get it now and get it early, or get it before, like earlier in the off season, and hopefully build, like you said, build up that immunity and be good for the season. So I know Kelly Stafford had a pretty big reaction on Instagram where she was saying that it kind of ruined her life basically for a few days. So did you have any thoughts on that?
Yeah, she was very angry. So my
Hmm.
question is, what did the doctors tell Kelly and Matthew Stafford, and how did they present it to her? In
Hmm.
my experience as a doctor, how a doctor presents results to a patient can vastly make a difference in how they react to it. If they were told that definitively the positive test was wrong, I can understand her reaction because that's the wrong thing to say to a patient. Because,
Yeah.
first of all, it's incorrect to definitively call it a false positive. It also causes the patient to distrust the lab and the testing procedure, which
Hmm.
is really unfair to the lab because, in retrospect, based on Dr. Sills' statement, the lab did nothing wrong and that test was done correct.
Hmm.
So if I'm a doctor in this situation, instead of telling Matthew that you have a false positive, the test got it wrong, I'm telling him that the likelihood of a false positive is generally considered to be very low. So while it may be a false positive, we should manage you as if this is a true positive, which is the safest thing to do.
Yeah.
It's good news that multiple subsequent tests have come back negative, Matthew, which is reassuring that if you have the virus, you've likely cleared it from your body and you're at low risk to yourself and others. But we should stick with the CDC and NFL guidelines that recommend a 5-day quarantine period. So
Hmm.
if you test negative on day 4 and day 5 and you remain asymptomatic throughout, Matthew, you're fine to go back to work and play.